Hi everyone, and welcome to my Dangerous Idea presentation. Today I will be talking about the potential dangers of using a ketogenic diet as a cancer treatment. Cells extract energy from glucose primarily through a process called respiration. First, glucose is broken down in the cytoplasm via glycolysis, shown on the left side of the figure. This process occurs without oxygen and can produce two molecules of ATP through fermentation. The second part of this process is called oxidative phosphorylation, where electrons are transferred from glucose to oxygen, resulting in the generation of 25 to 30 ADP molecules. Oxidative phosphorylation can use fats and amino acid derivatives to produce energy, whereas fermentation can only use glucose. Cancer cells rely more heavily on fermentation, and therefore glucose, for energy because they're often in densely populated, low-oxygen environments. This is known as the Warburg effect, and has informed countless cancer research studies over the years. Cancer cells need glucose to produce energy through fermentation, whereas normal cells can use fat and protein instead in oxidative phosphorylation. Therefore, it is possible that we could starve cancer cells selectively by limiting glucose and instead providing energy through fat instead. By putting cancer patients on a low-carb, high-fat diet, could we slow the development of their disease? The ketogenic or keto diet has gained popularity recently as a weight loss tool. However, it was actually developed in the 1920s as a treatment for epilepsy, a treatment which is still in use today. It is characterized as extremely low carb, moderate protein, and very high fat content. It differs from other low-carb diets like the Atkins diet in that fat comprises up to 90% of daily caloric intake. This forces the body to oxidize fatty acids to generate energy, rather than relying on the traditionally preferred source of energy, carbohydrates. This can be a useful tool in weight loss because it trains the body's metabolism to burn through fat, making it easier to decrease the quantity of stored fat a person carries. Undergoing such a drastic dietary change can have significant side effects, including fatigue, stomach and digestive issues, headaches, and nausea. Since it limits nearly all fruits and most vegetables, nutrient deficiencies are also fairly common. Fiber deficiencies also arise frequently because all grains, including fiber-rich whole grains like oats and barley, are excluded from the diet. More seriously, the metabolic shift to using ketone bodies for fuel can result in kidney damage and kidney stones as metabolic waste products become more acidic. Combining these side effects with the already serious side effects of chemotherapy may put a patient in pretty bad shape. The ketogenic diet as a cancer therapy has received a lot of attention in the last decade. As of 2014, there were 62 clinical trials in progress examining the effects of a keto diet on cancer progression. These results can be hard to track because there are so many variables that contribute to tumor growth, and it is difficult to compare results across different cancer types. Combining results across multiple completed studies showed that as many as 60% of tumors decreased in size while following the ketogenic diet. This evidence seems very promising. On the contrary, 10% of tumors in the same study actually saw a size increase relative to a control while following the ketogenic diet. This shows that predicting the results of the diet depends on the cancer type, patient, and about 1 million other variables involved in cancer progression. In addition, PET scans are commonly used to show where cancer is active in a patient's body. It uses the cell's glucose uptake as a proxy to represent the cell's proliferation. However, in an environment where there is not glucose, like in a person on the keto diet, the results of these scans may not be totally accurate. Any reduction in glucose could be due to the diet change rather than a decrease in cancer cell proliferation. In conclusion, I believe that the implementation of the ketogenic diet as a cancer therapeutic is a dangerous idea in cancer biology because its effects are not totally predictable and there is not enough evidence to understand its effects one way or the other. The side effects may also have a negative impact on patients' well-being and quality of life, which could decrease their rate of survival in the long run. Ultimately, there is no one-size-fits-all diet that works for everyone, and this is especially true when dealing with a disease like cancer. I think that the best diet is the one that works for you, in sickness and in health. Thank you for listening.